Good afternoon, folks. So today we are going to go ahead and get started on our chapter 31, the reproductive systems. Okay, so your learning outcomes for this chapter in general is going to be to summarize the organs of the male reproductive system. Okay, and that's going to be including the locations, the structures, and the functions of each. Describe the causes, signs, and symptoms and treatments of various disorders of the male reproductive system. Summarize the organs of the female reproductive and its location, structures, functions, etc. Okay, signs and symptoms, treatments of various disorders of the female reproductive system. We should be able to explain the process of pregnancy, including fertilization, the prenatal period, and fetal circulation. Sorry. Describe the birth process, including postnatal period. Okay, so what happens during the birth process and what happens directly after. Okay, compare several birth control methods. What types of different birth control methods are there? Okay, how effective are each of those? I believe some of us already did some patient education on birth control, etc. Okay, so some of this, maybe you guys can go back and review some of that information or talk with your classmates about what they know about those things. That would be interesting. Explain the causes and treatments for infertility. Okay, and we should be able to describe the causes, signs, and symptoms and treatments of the most common sexually transmitted infections. Okay, a lot of our patient education and that sort of thing is going to come from there, from sexually transmitted infections. Okay. All right, so your first objective, right, was going to be the male reproductive system. So we have the testes, okay, the seminiferous tubules. So testicles are divided into two sections, and each lobule is filled with seminiferous tubules. That's a tongue twister. Okay, there is sperm cell formation, okay, spermatogenesis. That's what that's called. The structure of the sperm cells is going to be the head, the midpiece, and then, of course, the tail, okay? So testes produce the male sex cells, which is sperm, right? Testicles, again, are divided into two sections. Each lobule is filled with the seminiferous tubules. Spermatogenesis is the process of sperm cell formation, okay? So spermatogenesis is the forming of a sperm cell. The head of a sperm cell holds 23 chromosomes and is covered with an enzyme-filled sac, which helps penetrate the ovum at the time of fertilization, right? So the mid piece of the sperm is filled with mitochondria to generate energy the cell needs in order to move around or wiggle around and get to the ovum in the first place, right? The tail is a flagellum that propels the sperm forward in the female reproductive tract. Okay, so you know it's wet and it's able to kind of swim almost like a fish, right? Pretty much, so it can get to the ovum. So an epididymis is located on the top of each testes and serves as a nursery, right? And or kind of holds all the sperms, right? For the spermatids to mature to a certain point into sperm cells. The vas deferens is a tube connected to each epididymis that carries the mature sperm cells to the male urethra. So once they are mature and they come out of their little nursery, the epididymis, right? They're going to go through the vas deferens. Okay, it's like a little tube. And it's going to go ahead and carry those to the male urethra, okay? Seminal vesicles secrete an alkaline seminal fluid, okay? This is rich in sugars and prostaglandins. The alkaline mixture helps neutralize the acidic fluid of the female vagina, okay? The sugar serves as energy, and the prostaglandins stimulate female uterine contractions to move the semen up into the uterus. So we also have the prostate gland, okay? The prostate gland is going to secrete an alkaline fluid, and during ejaculation, the muscular contractions of this gland help expel the semen out, right? So your prostate gland kind of acts kind of like, almost like a pump in that sense, because it contracts and creates that movement, right? The flow. So the bulbourethral glands or Cowper's glands, which is easier to say, are below the prostate gland and produce a mucus-like fluid before ejaculation to lubricate the end of the penis in preparation for sexual intercourse. The semen is the total mixture of sperm cells, the fluid from the seminal vesicles, right? The excretions from the prostate gland, the bulbourethral glands, okay? Nutrients and prostaglandins are included also in the semen. Each ejaculation has between 40 and 250 million sperm cells. So the external organs of the male reproductive system. So now we already figured out how sperm is kind of made, right? And that's all on within the inside. So the male external organs are going to be the scrotum, penis, erection, orgasm, and ejaculation, okay? So the scrotum is a pouch of skin that holds the testes. The scrotum insulates the testes from the rest of the body, keeping the temperature about 1 degree lower and allowing the sperm cells to survive. So if it gets too hot down there, then it's not a very good environment for sperm. They won't survive. So the penis is a cylindrical organ that moves urine and semen out of the male body. The shaft of the penis is composed of erectile tissue. The end of the penis is enlarged into a cone-shaped structure called the glans penis. The parasympathetic nervous system causes erectile tissue of the penis to become engorged with blood, resulting in the erection. During orgasm, sperm cells exit the testes and move into the urethra. Secretions of the prostate, seminal vesicles, again, the bulbourethral glands, are also released into the urethra to provide a medium or a transit kind of for the sperm cells to be moved forward, right? Makes it easier. Testosterone is the main male reproductive hormone responsible for the development of secondary sex characteristics such as chest hair, beards, thickening of the vocal cords to produce a deeper voice, of course, than the female. Males always have a deeper voice. Okay, so here is the setup, right? In a picture form, if you are filling out your assignment, right? I believe I gave you guys an assignment to a diagram probably on this. So this would be a good reference point for that, okay? And we just talked about all of these. So testosterone, again, is the male reproductive hormone. Testosterone is the main reproductive hormone, okay? Look at that beard. Gross. I'm glad I'm not a guy. So common diseases and disorders for the male reproductive system are going to be your benign prostatic hypertrophy, or BPH, a non-malignant enlargement of the prostate gland, commonly in older men. Okay. So the cause of BPH is, related just mostly to hormonal changes. And so that's why it's part of the aging process. The epididymis is an inflammation of the epididymis, or I'm sorry, excuse me, epididymitis is inflammation of the epididymis. There we go. Much generally starting out as a urinary tract infection and then spreading upward. Impotence or erectile dysfunction, ED, is the inability for a male to achieve or maintain an erection strong enough to complete sexual intercourse. Causes can be either physical or psychological sometimes. Okay, so this would be the inflamed testicle. The inflamed epididymis is right up here on top, with benign prostatic hyperplasia. You're getting compression on the urethra. Okay, this is a normal flow here. If it gets, inflamed and starts putting pressure here, it starts to close that up. Does that make sense? So prostate cancer is one of the most common cancers in men older than age 40. The cause is mostly unknown. Usually high levels of prostate-specific antigen are noted in the blood. So this is something that we do test regularly for. Usually any gentleman getting a yearly physical is going to have this run if he's over the age of 35 or 40. Well, if it runs in his family, most likely. Sometimes doctors will hold off till they're about, 50, maybe. I doubt it, but usually over 35, they start to check this. Prostatitis is inflammation of the prostate gland caused by excessive alcohol consumption, bacterial infections, trauma to the urethra. Testicular cancer is a malignant growth of one or both testicles. So one or both can be included. Okay, so here's some testicular cancer. Here's a tumorous note there. Normal prostate, okay, an inflamed prostate blocks the it blocks the urine from flowing from the bladder, right? So now we're going to get started on the female reproductive system. So ovaries produce the female sex cells and the female hormones, estrogen and progesterone. That's what's mostly put out hormonally for women, okay? Ovaries are located in the pelvic cavity. Oogenesis is the process of ovum formation. Ovulation is the process in which an oocyte is released from an ovary each month after the female has reached childbearing age. So in other words, once they start to cycle, right? Ovulation is the process in which the oocyte is released from the ovary each month, right? And kind of waits to be fertilized. The mature ovum is going to contain 23 chromosomes. And when it combines with the sperm cell, the resulting cell will contain 46. As the mature oocyte is released from the ovary during ovulation, the infundibulum, okay, the fringe expanded into the fallopian tube, this little fringed part here. I don't know if you can see my little mousey moving around here. Okay, is prepared to catch the egg cell and propel it towards the inside of the fallopian tube. So the internal accessory organs of the female continuing, okay, the fallopian tubes, okay, or the infundibulum. As a mature oocyte is released again from the ovary during ovulation, it kind of catches the egg and propels it towards the inside of the fallopian tube. So can you see my little mousey here, right? It kind of catches it right here in the little fringy parts and propels it down in here to the fallopian tube. Okay, and then it pushes it from there into the uterus. Okay, the uterus is a hollow muscular organ that receives a developing embryo and sustains its development. Okay, so that's where it hangs out once it's ready to go. The inner lining of the uterus is vascular with a rich blood supply. Okay, I want to keep that embryo nice and healthy. The middle portion is a thick muscular layer, and the outer layer secretes serous fluid to coat and protect the uterus. The vagina extends from the uterus to the outside of the body. So from the uterus, we come down to the vagina. Muscular folds called rugae, I believe is how you pronounce it, allow for expansion to receive an erect penis during sexual intercourse, as well as to provide an adequate passageway for delivery of an infant. So it expands also as well for delivery of a child. So external accessory organs of the female reproductive system are the mammary glands, which secrete milk to nourish newborn children. Mammary glands are located beneath the skin in the breast area. The pigmented area around the nipple is called the areola. Milk production is stimulated after childbirth by hormones. The prolactin and oxytocin kick in, okay? And that's what kicks in the mammary glands to start milk production. So the external genitalia of the female reproductive system consists mainly of the labia majora and the labia minora. The labia majora is composed of adipose tissue, which protects the other external female reproductive organs, kind of like a covering, right? The labia minor are the inside the labia majora, form a hood over the clitoris, right? Kind of another form of protection. Bartholin's glands secrete mucus into this area during sexual arousal to allow smoother insertion of a penis into the vagina, and of course, assist with sperm flow. The clitoris contains the female erectile tissue, which is rich in sensory nerves. The perineum is the area between the vagina and the anus. This area is traditionally clipped during childbirth in a procedure known as an episiotomy. Okay, so what happens is if the baby's head is too large or what have you, this little piece right here is what they're talking about, the perineum. This is what they clip from right here, the opening down a little bit. They kind of open it and give it a little more space for the child to be born. So a new approach to avoiding this or cutting like that in this area is positioning. I've also heard of wet, warm towels or compresses, kind of soften up the skin, moisten it up a little bit, kind of a thing to help it stretch a little bit better. But usually you definitely want to get one of those sort of approaches going first before they just go ahead and do an episiotomy, because it's definitely painful. I've had one. During sexual arousal, stimulation causes the clitoris to become erect and the Bartholin's glands become active. If the clitoris is sufficiently stimulated, orgasm occurs. Walls of the uterus and the fallopian tubes contract during orgasm to help propel the sperm toward the upper ends of the fallopian tubes, right? The whole point is to procreate. And so the whole system is pretty, I guess you want to say, is set up in which that we are trying to get that sperm to go ahead and fertilize that egg. Okay, so beginning at puberty, the hypothalamus secretes increasing amounts of hormones to cause the ovaries to produce estrogen and progesterone, which are responsible for the female's secondary sex characteristics of breast development, increased vascularization of the skin, and increased fat deposits in the breast, thighs, and hips. The first menstrual cycle is called the menarche. Okay, that's your first cycle or first period for a girl. And menopause is the end, right? Or the termination of a menstrual cycle because of the normal aging process. It stops, right? I don't know if everybody's ever heard of that. The biological clock is ticking kind of a thing, right? Because it does, it stops. Hormonal changes occur in a pretty progressive manner each month to culminate in menstruation if the egg has not been fertilized, right? So if the egg has not been fertilized, then certain hormones start getting secreted, and then of course that kind of jump starts the women's menstrual cycle. Okay. All right, and this is just a little picture pretty much of what I said, kind of a thing. Menopause is not fun for women if you've ever heard them complain. So some common diseases and disorders for the female reproductive system could be breast cancer. This is the second leading cause of cancer deaths in women after lung cancer. Causes are largely unknown, but may be related to hormonal changes or the presence of certain genes, that sort of thing. Oh, well, and your environmental kind of environment as well, too. If you're a smoker, that sort of thing, okay? I don't necessarily know that it would cause breast cancer, but you're putting carcinogens in your body, right? Kind of a thing. Cervical cancer generally develops slowly and can be detected by pap smears. That's why it's really important that we ask our women of childbearing years to have their pap smears done yearly. Weak immune systems may be a factor of the development of this cancer. their bodies aren't able to fight it off, and so it gets out of hand, kind of a thing. Uterine cancer is most common in postmenopausal women. The cause is mostly unknown, but may be related to the increased level of estrogen. Okay. So if anybody ever comes in and they say that they have a difficult menstrual flow, or they have really bad cramps, you have a woman coming into the office, or a girl sometimes usually will complain that she has really bad cramps during her cycle. It's called dysmenorrhea, okay? Difficult menstrual flow, okay? Menorrhea is menstrual flow, and then dys, of course, is difficult. All right, so endometriosis is a disorder in which tissue similar to that which forms the lining of your uterus grows outside of the uterus, okay? So that lining that we like to be on the inside actually starts to grow on the outside cavity, okay? Fibroids are muscular tumors that grow in the walls of the uterus or inside the womb, okay? Those can be really painful. I've heard they can be really painful. Fibrocystic disease, breast disease, causes a person to have lumpy and sometimes painful breasts. It is a very common condition and not necessarily harmful, okay? But most definitely uncomfortable. Cervicitis is the inflammation and irritation of the cervix. Premenstrual syndrome, or PMS as it's known, is a collection of symptoms which occur just before a menstrual period, including anxiety, depression, irritability, sometimes acne, fatigue, food cravings, bloating, headache, abdominal pain, breast tenderness, weight gain, and loss of sexual drive, okay? So yeah, it's kind of an issue, but it doesn't always affect everybody the same, right? Everybody's hormones are a little bit different. Everybody has a different kind of cycle. But yeah, that's a lot to deal with. Sometimes we just wish men would get it, right? Vulvovaginitis and vaginitis are both inflammation and can be associated with an abnormal vaginal discharge. It's usually a condition caused by yeast infections, tampon use, or, just poor hygiene in general. The condition, can definitely be taken care of, but it's just an issue for women. So as long as it can be prevented, usually through good hygiene and safe sex practices. During sexual intercourse, the male deposits semen into the vagina. Sperm cells travel through the uterus to the fallopian tubes to fertilize the waiting ovum, okay? Although many sperm cells reach the correct area, only one sperm enters the ovum, okay? A combination of 23 chromosomes from the ovum and then the 23 from the sperm, as we found out earlier, combine, and they form the new site, which is now called a zygote. Okay, so once it's fertilized, the sperm is in there, it's called a zygote. Okay, that's fertilization. So one day after the zygote forms, a process called mitosis begins, okay, at a very rapid rate called cleavage. A resulting ball of cells called a morula travel down the fallopian tubes to the uterus, where it becomes a blastocyst and implants in the endometrial wall of the uterus. After a period of approximately 1 week, the cells become an embryo. The placenta is an organ that develops in the uterus from the blastocysts, or blastocysts, sorry. The placenta provides oxygen and nutrients to the growing baby and removes waste products from the baby's blood. The placenta attaches to the wall of the uterus and the umbilical cord arises from it. In most pregnancies, the placenta attaches at the top or the side of the uterus, okay? If the placenta is not in the right spot, this does cause other issues, which we'll get into, okay? The amnion is the protective fluid-filled sac that surrounds the embryo, the amniotic fluid, right? So the embryonic period spans from the 2nd week of pregnancy until the end of the 8th week, okay? After the end of the 8th week, cells of the inner cell mass organize into layers called primary germ layers, which all organs are formed. The fetal period, when the offspring is called a fetus, spans from the end of the 8th week up until the development, up until delivery of the newborn, right? So the 8th week on up until delivery is considered the fetal period. Between the 2nd and the 8th week is called the embryonic period, okay? Fetal circulation takes place between maternal and fetal blood. A fetus growing inside the mother's womb does not use its lungs to breathe until birth. So its circulatory system is a little different from that of a newborn baby. Instead of the lungs supplying the oxygen-rich blood the fetus needs, the fetal heart has an opening between the upper chambers called the foramen ovale. The ductus arteriosus is a blood vessel connecting the aorta and the pulmonary artery to carry the blood away from the heart in the developing fetus. In fetal life, the ductus venosus allows variable portions of the umbilical and partial venous blood flows to bypass the liver. So instead of breathing, it's just circulated in a different way, essentially, okay? Many hormone changes take place when a woman is pregnant. Embryo cells secrete human chorionic gonadotropin, which stimulates the corpus luteum, okay, or HCG, okay? And it can stimulates the corpus luteum to continue to secrete estrogen and progesterone. So we're constantly secreting estrogen and progesterone still. The placenta also secretes estrogen and progesterone, which stimulates the uterine lining to thicken, right? We want to start protecting that fetus. These hormones also stimulate development of the mammary glands, inhibit uterine contractions, right? We don't want to have any contractions while we're pregnant unless we're ready to deliver. And stimulate enlargement of the female reproductive organs, right? So then that way we can start stretching out, making some room. Relaxin is secreted to relax ligaments of the pelvis, right? The placenta secretes lactogen, which stimulates enlargement of the mammary glands. Aldosterone is secreted from the adrenal gland, which increases sodium and water retention. Secretion of the parathyroid hormone increases and high calcium levels in the blood are maintained, right? We want to give as much calcium as we can to that baby. So then that way, or the fetus, I'm sorry. So then that way it can go ahead and develop into a healthy baby. Okay. So then we have the zygote, you can see here from fertilization, right? Meiosis happens, fertilization, zygote, mitosis, newborn, and then development into adult. So the birth process, this is going to be one of those objectives we talked about. Your birth process ends pregnancy. Okay, the process begins when progesterone levels fall and the uterine contractions begin as oxytocin is once again released. The cervix thins out and softens. This is also called effacement. The cervical dilation to 10 centimeters has to happen, okay? And this allows for large enough opening to actually deliver the infant. Expulsion is also known as parturition and forceful contractions, and force the fetus from the uterus into the vagina. The placental stage occurs as the afterbirth. So after the baby is born, it separates itself from the uterine wall and also is expelled through the vagina. The APGAR test, APGAR, is a test that is done twice. Once at 1 minute after delivery, the minute they pull them out, they run all these little tests and clean them up and all that good stuff, right? And then again, after 5 minutes have passed, to assess the respiratory effort, heart rate, skin color, reflexes, and muscle tone. So They do it 1 minute after delivery, then they do it again 5 minutes later. And the APGAR test for the respiratory effort, the heart rate, the skin color, the reflexes, and the muscle tone. Postnatal period is the 6-week period following birth. Okay, so the first 4 weeks are called the neonatal period, and the offspring is called a neonate. After childbirth, prolactin causes the mammary glands to produce milk. If the mother does not choose to breastfeed, the hypothalamus will inhibit the release of prolactin and oxytocin, and milk production will stop. Okay, so if that doesn't continue to be stimulated by the baby nursing or some sort of pumping, we're not producing milk, then the body will produce hormones to stop producing it, because you're essentially letting your body know you don't need it. So here's the APGAR. Okay, so again, the activity, the muscle tone, the pulse, G, grimace, the reflex, irritability, okay, appearance, skin color, respiration, okay, and here's the point scale. So when the baby was born, was, the activity absent? Was it silent? Did it not move around? Did it just pop out, right? Was there a pulse? Okay, was there a pulse at first, or did you have to get it going, kind of a thing? So floppy, were they really floppy and really loose and not, frigid and crying and stiff, right? Kind of a thing. Appearance, are they blue or pale? What is that a signal of? Do you guys remember when we talked about that? You guys think of that name? I hope you find it. Let me know. And then respiration, is he breathing on his own, right? So he gets 1 point if his arms are flexed when he pops out, right? He has a pulse, but it's below 100. Okay, minimal response to stimulation. Like, yeah, he responds, but he's not crying or anything. Like, he's not throwing a fit, or he's pink, right? He has a pink body. Maybe his little fingers or toes are just a little blue. And then the respiration, he's breathing, but is it slow and irregular? Are you having to help him out? And then, of course, the way we all need him to be at 2 points here: active, over 100 beats a minute, prompt response to stimulation. They cry, they're cold, they're screaming, they're wailing, right? They're pink. You can tell blood flow is working good, right? All the cells are getting oxygen, etc. And they're crying vigorously. You can hear them, you can see them breathing, right? Really fast, kind of a thing, catching their breath while they're crying. So that's how APGAR scoring is done. And again, at 1 minute and 5 minutes. So another one of your objectives was the contraception. So complete abstinence is really the only way to prevent pregnancy and STDs, really. Well, not really even STDs, because you can still get them in other ways. But however, the rhythm method is sometimes effective. Okay, so with periodic abstinence on days to believe to be your most fertile, a woman can kind of detect that. And with a regular menstrual cycle, she knows she has 9 or more days each month when she is actually able to get pregnant. And these fertile days are about 5 days before and about 3 days after ovulation. Not her period necessarily, but after ovulation, okay? As well as the day of ovulation. So withdrawal of the penis from the vagina prior to ejaculation will also sometimes be effective in that sense, if you know what days and all that good stuff. Sounds like a whole lot of work to me, if you ask me. Barrier methods are going to include your condoms, contraceptive sponges, diaphragms, cervical caps, and shields. Hormonal methods may be things like your oral contraceptives, birth control pills, okay, that sort of thing. So we now also have injectable contraceptives, insertable contraceptives, contraceptive implants, transdermal contraceptives. So what do we learn in pharmacology? What is transdermal? It's a patch, right? Goes on the outside, you stick it somewhere, right? Intrauterine devices or IUDs, and surgical methods, right? Such as going ahead and removing the ovaries, or, that sort of thing. Tying your tubes, tubal ligation is what they call that. We also now have this thing called emergency contraception in the form of the morning after pill, and is also available over the counter for women over 17 years of age. Okay, so that is available, but a lot of these, most of them don't also protect from sexually transmitted diseases either. So infertility is the inability to conceive a child. Okay, so in the United States, 15% of causes are unknown, 35% of causes are related to the male partner, and 50% of the causes are related to the female partner. Infertility tests related to the male partner would include a semen analysis to check for the number and the motility of the sperm. Are they active? Is there a lot of them? Right? Are they good cell sperms? Or are they, not developed, etc. Testosterone levels can be also measured. There are many more tests for the female partner, from simple methods such as taking a morning body temperature to more complex and invasive procedures such as, blood tests, urine tests can be analyzed for hormone levels, biopsy of your endometrium tissue. My friend has had to do that. It's painful. It's a lot to go through. Laparoscopy, x-rays are more intensive tests. Treatment for infertility will be related to the results of the testing. In other words, we'd have to figure out what exactly the issue or the root cause actually of your infertility is before we could go ahead and give you suggestions on what we should do or where we go from there, right? But normally we have some suggestions such as surgery. Okay, maybe we can repair an abnormality. Sometimes there are fertility drugs, or hormone therapy may help you to become fertile, or to produce a viable egg, etc., depending again on what your situation is. Procedures such as artificial insemination, in vitro fertilization, or the use of a surrogate can definitely help a couple have a child and enjoy parenthood. Okay, so endometrial biopsy, what happens is we go in here, we widen open the cervical canal with a dilator, okay, or probe. Remember when we went through our surgical class with all the different tools and setup and how to help with surgeries, okay, or biopsies. So in this instance, a uterine wall is going to be scraped with a curette. If you remember, that is a tool that you use. It has kind of like a scoop. It's kind of a little bit sharp, so that way you can scrape cells or tissue from certain areas of the body. In this instance, the uterus. So sexually transmitted infections occurring in both sexes. So sexually transmitted diseases affect everybody, not just male or female, right? So AIDS is caused by a virus and is transmitted through sexual activity. Chlamydia is the most commonly reported as sexually transmitted infection in the United States. There are often no symptoms until the disease is actually spread, okay? Genital warts are also known as condyloma acuminata. This sexually transmitted infection is caused by human papillomavirus, or HPV. Gonorrhea is a bacterial sexually transmitted infection with a white, greenish, or yellow discharge noted. Okay, there's usually a smell. Okay, herpes simplex includes type 1, which causes oral blisters known as cold sores. Okay, and type 2, which is known as genital herpes. Pubic lice are commonly called crabs and are caused by a parasitic infestation in the genital area, most commonly spread through sexual contact, or sometimes sharing of clothes, etc. maybe. Syphilis is a bacterial sexually transmitted infection which begins with a painless sore known as a chancre, I believe is how you pronounce it, at the first stage. The second stage is characterized by a rash and lesions in the mucous membranes, along with flu-like symptoms. Often years later, the third stage becomes apparent with brain damage accompanied by eye, heart, blood vessel, liver, and bone involvement. Okay, so syphilis is pretty scary, if you ask me. Trichomoniasis is a curable STI caused by parasite, right? Little parasitic things, and again is transferred through sexual contact. Here are just some kind of visuals for you guys of what these sort of things look like. Okay, so in this one, this would be chlamydia in women. Okay, this is the cervix, and this is your cervix on chlamydia. Okay, see, it's really inflamed, looks really infected. Herpes, a newborn born with syphilis. Pubic lice. Trichomoniasis, you can see they're using a speculum that's on the inside of the vaginal canal, cervix. Gonorrhea bacteria. This looks like what that discharge would look like coming, it looks probably like from a penis there. Okay. Not very comfortable stuff. Okay. And just one more thing about sexually transmitted diseases and reproduction, guys. Use this or the babies win. All right, that's all I got for you guys, okay? So I'm gonna go ahead and I'm gonna post this to your board. There is no assignment for this PowerPoint. We got the holiday weekend. You guys got plenty of things to do, plenty of questions in your assignment. Reproduction is fairly common, but I feel like if you guys have any questions or if you want a little more discussion or anything like that, we'll see you in one of our meetings probably next week. Or you can definitely go ahead and reach out to me through my email. I am still going to be available for you guys this evening, okay? Via email. So just let me know if you need anything. You guys have a great night. Take a really good look at this chapter summary, okay? Take note of these things. And we'll talk to you guys later.